Hello there. This is Wael Al-Delaimy. I'm a professor of epidemiology and public health at the University of California, San Diego. And I'm providing an update not almost exactly a month after my previous video describing COVID. And I want to focus on herd immunity because that's something that is being mentioned and circulated very frequently in the media. So this is a kind of a good illustration. I found it from Wikipedia that describes herd immunity. And basically what we have is, in this case, it's showing here, those are people over here who are infected. So they have the COVID, for example, COVID-19, and then they are going to spread it to others. And eventually, everyone spreads this to the other until all the red here, in this case, get infected. So the community becomes all infected. Some of them will require hospitalization, and some of them will need ventilators, and some of those who need ventilators would die. So the aspect here is that by doing the social distancing, so here, the situation in the second one is that some people have immunity, the yellow folks over here, the yellow, because they got infected and they're not going to be reinfected. Of course, we don't know if this is the fact. It is an assumption that those who get infected are not going to be reinfected, but this is still up there. If they are prone to be reinfected, then that's a major problem, really big problem. If they are not going to be reinfected, at least they are going to be protected from further infection, but we don't know that for sure. What social distancing is doing is more or less almost like a situation here where people who are infected are staying home so they don't infect it to the others, so then the community is still safe. However, once the social distancing is released or people are back, then we will end up to this figure again, where those who are still infected are going to infect everyone else. So the reason that the social distancing in the shelter in home is kind of being delayed is that with the hope that more of the infected people get resolved, they are not infective anymore, or they go to the hospital, they get hospitalized so they are not infecting others. But 80% of the people don't go to the hospital, and at least 50% of those who are infected don't even show symptoms. So we have a lot of people in the community who are infected. Now, why then, the question would say, why is it that since we have been in shelter in here in San Diego, for example, for a month or more, and why then we still have the infection going on? Everybody who had the disease should have by now got resolved, because usually it takes 2 to 3 weeks. Well, that's a good question, and I want to demonstrate this in the answer here. So let's say we have here one person, okay, who is infected. Now, if they are going to stay at home for 2 weeks in self-isolation and not go anywhere, not meet anyone, then they are not going to infect anybody. So then we are going to get rid of the virus. And that's actually what some countries like New Zealand and others are trying to do. They're going to isolate people until there is no more a virus, and they will not allow anybody to travel in to the country and bring the virus. So that's a policy. We can't do this in big countries like the US and others. So at the same time, in the shelter in, people will have to go out, get a grocery, need to go to, something important, go to the health clinic maybe, or anything that is important. So it's not complete shelter. People are still going out. So there's a chance, even if that infected person, because they don't know they're infected, so they're going to go and say, I'm going to go do some shopping or whatever. What's going to happen is they're going to meet many people. and then based on the data, each person who's infected can infect 3 more people. Okay. So what's going to happen? Those people, those 3 people, are going to go back to their home or wherever they are sheltered in and infect others. So another 3 people. That's around the range of COVID-19. Every infected person infects almost 3 people, more or less. So then you can see how this can grow and grow, and then this is almost like relay. So this person had the disease here for 1 week, and then gets transmitted to this person. This person, after 1 week, then they're infecting somebody else, and so it's ongoing and ongoing. That's why the problem is going to be there. Actually, it has been estimated that each person infected can transmit to 400 people over a period of 30 days. If they're out in the open and getting to meet and contact with people, they can infect over time through this. So 1 person infects 3, each one infects 3. So it's kind of exponentially increasing, so that over a period of 30 days, there are around 400 people infected from that 1 person. So you can imagine, if we have 100 people, then that's around 40,000 people getting infected, and so on and so forth. So unfortunately, the situation is not going to be resolved if the social distancing is released. Now, let me show you what also, this is data from San Diego County, and these are the new cases. And this is, for me, is more important than the total cases, because we're seeing how is the virus going on. And this is starting from March 12th, and you can see the total number of cases were increasing. There are dips, but it's still it's increasing. And it has been going down. There are ups and downs, but still, this is the latest today or yesterday, 2 days ago, we have 82 new people in 1 day. So the virus is still out there. Now, out of those 82 people, those are the people we got to diagnose them. Why? Because they probably had symptoms and they end up going to the hospital. So that's around only 20%, because the other 80% have the virus, but they don't have to go to the hospital. They might have the symptoms. So if you say there's 82, then you multiply by a factor of 10, then there might be 800 or 1,000 people in San Diego County who are infected today or 2 days ago. So we are not going to control this unless we go to the 0 single digit. Then we say, okay, the virus is almost dead. It's not there. No one is transmitting it, and we've been now without any viruses for a month, let's say. Then there's no chance that somebody is going to still have it and transmit it. And that's where kind of China has now reached, and other countries like I believe Singapore and so on, where they managed to kind of keep the shelter in until there were almost no more cases, then they released it. So as such, as long as this situation is there, and if the kind of social distancing is released, or is opened and people are going back, then we can see those 82 or up to 1,000 people in the community, each of them will transmit to another 400 people within a month, and then we see an uptick after a while. Now, that's where the balancing is happening now, and the decision makers in each state is trying to decide, okay, the risk and benefit. If we keep sheltering in people need jobs, income, everything, the economy needs to go on. So they are thinking of how they're going to balance that. And I think there are no way around it until we get a vaccine. And by all accounts, the vaccine is not going to happen a year or more from now. So until then the community will still be vulnerable to be infected, just like I showed in the previous figure. And the only things that we can do is really wear masks and do the social distancing to limit the contamination and the spread of the virus. Now, just an update, now we know a little bit more about how the virus infects the lung. In my previous video, it was early on, people were still not sure, but now it's a little bit more clear that actually the virus goes deep into the alveoli, and that inflammation in the alveoli generates a reaction from the body. So the alveoli, the sacs where the breathing and the oxygen happens, they exchange between the blood and the oxygen deep in the lung tissue. That gets filled with fluids, pus and other inflammatory reactions of the body to the virus. So it gets filled with fluids, so there's no more exchange. So people will have difficulty in breathing. And it takes, a ventilator if it's severe, or the immune system can deal with it and people get resolved. So as such, we don't have a treatment yet, and we don't have a vaccination. So we have to keep this for a while. It's going to be a lifestyle almost, that we can't come close to people in large gathering. We have to wear the mask. And again, there are different types of masks. The best one are called the N95, which are now in shortage. So they are preserved for the healthcare community. If they become available, then it helps because it is a better mask that protects from the virus. But for now, any mask is going to help in not having these droplets travel. If somebody coughs, if they have the infection, they're not going to travel if they have the mask. So that's why now the recommendation is to put the mask. And we will have to adjust our lifestyle as such and do things from home, go out only if necessary. And that will take some patience and effort. But think about it, is that this is for protection for everyone. It's not just about us, it's about the vulnerable, the people with low immunity, the people who are older with low immune system, the people who are smokers, they are at high risk, and other vulnerable populations.